So how do you know if hormone replacement therapy is right for you? That's a tough question. At least we've made it a tough question. Women live a third of their lives after menopause, and estrogen receptors are all over your body, in your heart, brain, in your blood vessels, vaginal tissues, in your bladder, in your skin, in your bones. We know that estrogen decreases in menopause. The hot flashes are just a small part of it. They're from the declining levels of estrogen. And once your estrogen levels have been low for a while, theoretically, your hot flashes should go away. Now, if you have a lot of adrenal issues or toxicity issues, your hot flashes will last a lot longer. But the hot flashes truly associated with the hormone changes of menopause last anywhere from like 1 to 3 years typically. Unfortunately, that's really all that traditional OBGYNs are trained to treat is the hot flashes. Oh, layer your clothing so you can just rip off your clothes when you get hot. Oh yeah, I'm in a board meeting and I'm gonna say, excuse me, gentlemen, but I need to change my clothes and pull off my jacket because I'm having a hot flash. Don't mind me. That doesn't fly. Sleeping pills, antidepressants, things that affect your blood pressure. They give you those to try to decrease the hot flashes. You really need to not have estrogen deficiency. We don't need a ton of estrogen in menopause. We need a stable amount. Protects our brain, protects our bones, protects our skin, protects our heart. One of the questions that I get though is, when is it too late to start? And that is something I cannot answer to the general population. You have to individualize that with your provider. It takes a heart-to-heart conversation and an evaluation of your overall health. Why is that? Estrogen increases blood vessel elasticity. One of the things that can happen is that our blood vessels will get a little plaque in them. The concern is if we already have plaque and now we increase blood vessel elasticity, can that cause the plaque to break off and lead to a heart attack or a stroke? It's really a theoretical risk. Nobody knows how to quantify it exactly. That is why there is this question about, well, if you're over 10 years into menopause, maybe you shouldn't do hormones. That's just a number. You are not a number. We need to look at your history, your other medical issues, maybe do a cardiac evaluation. There's something really inexpensive called a coronary artery CT scan where it looks to see what kind of plaque you have already built up in your heart. There's something called an ultrasound, which looks at the thickness of the carotid artery, which is the blood vessel in your neck. You really need to be individualized and tested, and you can't just make a blanket statement. These blanket statements really make me nervous, and I don't use them. And so when people sometimes will call our office and say, well, do you give hormones to women at a certain age? I really need to know you, and I can't answer that just as a blanket statement. What we do and what you need to look for is a doctor that will individualize your care, honor your desires, figure out what your goals are for the next 10, 15, 20, 30 years, come up with a plan to help you stay healthy. And if you're not healthy, let's get you healthy. The current medical system is sick care. It's not health care. They don't know what to do with healthy people. If you're not really sick, they say you're fine. It's just normal aging. This is a rant, and I'm sorry. So back to the hormone question though. How do you know if you're a good candidate? If you're newly menopausal, you're a great candidate. The highest benefit is for women who start hormone replacement therapy within 5 years of menopause. You get significant increased benefit. If you're over 5 years into menopause, that doesn't mean you get no benefit. It means you don't get as much benefit. So I'm sorry you didn't have a doctor when you were going through menopause that knew how to address this with you, but we shouldn't penalize you now that you finally have your eyes opened and say, no, I'm sorry, you missed that window. You can't do hormones. I call BS on that. We need to individualize your care. There's a lot of buzz going out around menopause. Thank God, right? Massive amounts of women now are going through menopause or are in menopause recently. Finally, there's enough noise and enough celebrities willing to talk about it. Women are realizing, wow, this is not just suck it up, buttercup. This is what you have to deal with. There are things that we can do to be proactive about our health, maintain our hormones at healthy levels, protect our brain, protect our heart, protect our bones, keep our muscles so that we can get out of a chair. There's people who cannot get themselves off the toilet seat because their muscles are so depleted as they age with frailty. We do not want to be frail. Optimizing your hormones is a part of that. It's not the whole answer. If you think that all you need is hormones and you can live your crazy lifestyle and eat crappy food and be so stressed out all the time that your body's thinking a tiger's chasing you, I got news for you. That ain't gonna work. Get evaluated, talk to somebody who understands, and figure it out. And if you don't get the answer that you feel like you deserve, if it doesn't resonate with you, then get another opinion. There's a lot of opinions out there. If somebody says they know everything though, run the other direction. Medicine and science is never settled. We are always looking and learning and exploring. But find someone that listens to you, that helps you understand your goals, and can help you get there, and is willing to be open-minded and continue to learn. And have that hormone replacement therapy discussion.